Joining me right now, I just saw him speaking on the floor of that august body as they move through this. First of all, some just clerical issues with you, Congressman. Do you know where this stands right now, when there will be a vote?
Well, there were 2 hours of debate. I think we've finished about an hour or a little bit more. There's usually inquiries or statements asked to be made. So I would think within the next couple of hours, probably, there'll be a vote. There'll be actually a few votes, as you know, Neil.
Right. So, Congressman, when I was last chatting with you, you had serious concerns, were undecided. How will you vote tonight?
Well, I'm voting yes. My concerns were not with the fact that we need comprehensive health care reform. I think we do. My concerns were how equitable was the bill. States like mine, New York, under the Senate bill, were treated horribly and not reimbursed to the point that they should, because we have been a do-gooder state and provided good coverage for our people all these years. We were penalized under the Senate bill, and also New York's public hospitals, which have to treat indigent people, were treated very, very poorly. And I said that I would not vote for the bill unless that was fixed. I told that to the Speaker. I had a meeting with the New York delegation, which I called with the Speaker. We made it very, very clear, and to her credit, she was able to get us back a great deal of what we need. It's not as good as the original House bill, but it's much, much better than the Senate bill. So I think that this is a bill that I can support, and I hope that after it becomes law, we can come together and try to improve it.
I've talked to a lot of your Republican colleagues, sir, who don't share that kumbaya enthusiasm. Maybe down the road they will, but there are a lot of hurt feelings, and there are a lot of anger, and the Republicans are charged that you guys just shut them out. And then I know a lot of your colleagues say, well, Republicans shut themselves out because they didn't offer ideas. A lot of vitriol, as I've indicated, and anger. And many say these next months of this Congress, nothing's going to get done because the well's that poisoned. What do you say?
Well, I hope that's not the case. I always try to reach out to both sides of the aisle. I have a lot of friends on the Republican side of the aisle. I think we need to try to work together because that's why the American people send us to work. I mean, one of the problems that I find with some of my Republican friends in Congress who argue that this is too comprehensive, that we should go slower, that we should do it incrementally. When they were in control with a Republican president for 6 years, they didn't do anything incrementally. They didn't move at all for health care reform. As was said before, I think by Governor Huckabee, that everyone agrees that kids should be on parents' policies till they're 26, or pre-existing conditions shouldn't happen. If the Republicans, when they control things, had done those incremental steps, we wouldn't be talking about comprehensive health care now. But you can't say we're going too fast, but when you had the opportunity, you didn't do anything at all. So I don't find that a very, plausible excuse. I do think, though, we have to find a way to work together.
Congressman, I'm sorry, sir, but I think what they argued is they did try to do stuff on the private insurance front and the rest, and were shot down and not going anywhere. Sometimes you're quite correct within their own party, as was the president's efforts to address Social Security. He was burnt not only by opposition, but certainly by many in his own party. So. It's fair to say they didn't do anything. They didn't do it in enough mass, right?
Well, we have a lot of problems in this country, and, we talk about them all the time, and they're only going to really get solved. I mean, it goes beyond health care. It goes the jobs and the economy and immigration and education and all the things. And I think we do better when we work together, and I hope we can. Energy policy. And, the well is poisoned, but it's been poisoned before, and we owe it to the American people to work together.
You're right about that. It has been poisoned before, a lot of times before. Congressman, thank you very much.
Thank you, Neil. Thank you.